what they're going to do because this hand, my right hand, is really the only hand that can be used to put IVs in, and I don't know what they're going to do because this hand just doesn't have any veins left. Right, and so basically last week I didn't get chemo also because they were waiting for my blood cell count to go up so that I could get a board surgery this Monday. Unfortunately, everything has been changed. So basically last Friday they gave me a call saying it's changed, everything is changed, so this Monday there is no surgery for the board. Right, so in summary, what happened is that last 2 weeks I haven't had any chemo. I didn't get a board surgery. I still don't have a board. I need a board today actually. It would be really wonderful if I would actually have a board today to be used. Right. And I don't know when the surgery is going to be because they haven't given me a call yet. I don't know why, what's going on. So the whole thing is going to be a little bit of a mess again because as soon as I start getting the chemo, my white blood cell count is going to go down again because the chemo itself has this effect. And right, I don't know. We'll see what's going to happen. Right, so I have put on foundation. Let me put on some conditioner, not conditioner. Let me put on some under eye corrector and concealer. Right. So actually these items are the only things that are my items that are not from Boxycharm. All that, so basically foundation and this corrector stuff, all the other stuff is from Boxycharm. Usually beauty boxes do not send foundations and these kind of things because they basically depend very much on person, right? Everybody has a little different shade, so they usually don't send these kind of items to people. Right, so let me tell you what actually happened last Monday after I came home. So right, I didn't get the surgery. I was really sad. I was really upset. And also I was upset that I wouldn't be able to get chemo last week because, you know, when I don't actually get chemo, it means that cancer is growing and moving forward. You know, cancer is not going to take a break and wait until my white blood cells go up again, right? So that was really upsetting. And so, right, I told you that I was really dehydrated. And so on the way back, I started getting a really severe headache. I did a stupid thing on my way back. I grabbed a cup of coffee. I didn't have much, I had only a few sips. And then I started developing a very severe headache. So by the time we got home, my headache was so bad that I felt like I'm going to vomit, and I indeed vomited. I vomited like, I think, total of maybe 10 times. I mean, I was trying to eat, I was trying to drink. I knew it's probably because I'm dehydrated. So one time I had it, the same thing happened to me. I think it was last fall. Yeah, I had a day where I was sweating a lot because I was taking some kind of medication that made me sweat enormously. I had been sweating several days. It was hot outside. I had to do things outside, take my daughter here and there, and I wasn't keeping up with basically drinking water. And then in the evening, I had a very severe headache to the point that I started vomiting. And I ended up actually going to the emergency room, and they didn't actually do anything in there except a CT scan to see if my brain has a cancer, right? And they actually made me wait there with this horrible condition for hours, and didn't even give me like IV with liquids. So now this time when it happened again, I was like, okay, it feels like I need emergency care, but I don't think I'm going to get it, because if I'm going to go to the emergency room, they're going to just make me wait there, and going to do a CT scan again to check my brain, and then you know, it's going to be hours and hours. At least here I can, you know, vomit in private, not in a waiting room. I can lie down. And so I was taking like nausea medications and stuff, and nothing like kept, you know, I was vomiting everything out. But luckily I had a medication, ondansetron, that's in a form where you basically put it on the tongue or just chew it up, and it already gets absorbed into your system. So so I was able to actually get a little bit nausea relief, but the headache was still like, I mean, it was so bad. I felt like I don't want to live. Like I couldn't, like, it was just I don't have words to describe it. It was so bad. And so what I did, I took Ativan. So I have Ativan at home, a lot of it, and I took like 2 milligrams of it, which basically knocked me out. And a couple hours later, when I woke up, I still have that horrible headache. And so basically my hubby had woken me up, and then when he woke me up, I still had just horrible headache. So I just fall back to sleep, and overall I slept like 24 hours straight, and even the next day I was a little bit out of it. So yeah, so if in the future I have to have a surgery and they tell not to drink at all, I'm going to drink a little bit, because really that was horrible. So for some reason I'm very sensitive to this dehydration situation, and I think I made it worse with my own nerves. I tend to get very nervous with things, and I remember my heart was like pounding. I probably was having like a panic attack or something, and then I remember I was like hyperventilating, like, and then I forced myself to breathe more slowly, and then like the headache was kind of getting better. Like it wasn't as bad when I was like breathing more slowly, right? So I put on some setting powder, and now I'm going to do my eyebrows. This is from Boxycharm, Iconic London. It's my, right? And so you open this up, and it has this spongy thing. It has 2 different colors, as you can see. It came with this little brushy thingy, but it's really crappy. I'm not going to use it. I'm going to actually just throw it away, and I'm going to use my own brush, Anastasia Beverly Hills. And right, it's really amazing brow item. I was really surprised. So I've been using Shiseido brow kit. Let me open it up. Right, and I have to tell you that this thing is actually better. I don't know, I'm going to check what the prices are, but I was really pleasantly again surprised with this item. So thank you, Boxycharm. So Boxycharm is really, I think, a really wonderful. I think, like, I get a lot of different beauty boxes, like 16 different ones at some point. And now I'm actually reducing my beauty boxes down to just, I'm hoping to reduce them eventually down to just maybe 3, and I'm making decisions which one I'm going to keep, and I think Boxycharm is one that I'm going to keep. So, you know, basically saying that out of 16 different beauty boxes, it's top 3 out there. So Boxycharm, I think the items that the Boxycharm sends are often, they have high quality items in there. they are not just tiny little samples, and they are not from brands that you have never heard of, right? So these are my eyebrows. My eyebrows are getting harder and harder to take care of because my hair is just getting thinner and thinner. So one of the side effects with this chemo is hair loss. I read about it, and so they say that it's hair thinning, but let me show you. So I'm so scared. Like, it started a couple days ago. Like, my hair was just fine, but a couple days ago it started doing this. See, I'm just pulling it, and just enormous amount of hair comes out, and I'm going to just brush it now. And like today I haven't brushed my hair yet because I was just too scared to do it. I don't know what to do with my hair situation. Like, should I just cut it very short, cut it shorter, keep it as it is, and just keep it just kind of, you know, there are products you can puff it up and just make it look like it's not that thin. I don't know if I'm going to lose all of the hair, if I'm going to get completely bald. So last time it happened, like 6 years ago, I got chemo medication that caused me to lose all my hair. Actually, I have a video, you can just look into my videos. There is one video where I'm completely bald. It's from 6 years ago. Oh my god. So then when the hair started coming off, it happened after second chemo session. I think I was getting azithromycin or something like that. It was also called like red devil, I think, like, because it looked completely red, the chemo medication, and it's very difficult to handle. So okay, that's enough. Basically, when the hair started coming loose, I just cut it off, like, completely, and shaved it off, because I just didn't want to deal with losing the hair. I didn't want to. I knew that I'm going to lose all of it. I'm going to go bald, so I just didn't want to wait and see and, you know, how it happened. But now, just look at this. I just brushed it. You see how much hair is coming off. So this time, I read that this medication is supposed to actually not cause you to lose all your hair, but I don't really know. Right. Anyway, if I'm going to lose all my hair, I'm going to get a wig. I'm going to have to get a nice wig. So it's time to me for us to start to read about wigs and just kind of learn that art of how to take care of wigs, how to use them, apply them to your head, and so on. Okay, let's do eyelids next. I'm going to use Morphe, so that's also from Boxycharm. Morphe 15 and Night Master eyeshadow palette. So before that, I never purchased any Morphe items, so I have still not purchased any Morphe items. This is my only Morphe item from Boxycharm. So I've used this eye palette, like, I think on 2 occasions, and on both times I liked it. So right, so Boxycharm has sent a lot of brushes in the past 6 months, which is something I like when a beauty box doesn't just send you like cleanser and lipstick, but also, you know, sends other items like tools. crazy eye look. I'm just a little bit of color and that's it. Next I'm going to use under eyes. I'm going to use a pencil they sent, Bodyography Valley Bronze Eye Pencil. Right. I'm going to do a swatch. And on my eyelids I'm going to use Jonte Blue eye pencil. It's glittering actually. Let me do a swatchy. See, there's glitter on it. Pretty cool. To put a little bit more makeup on. I feel like I want to put a little bit more eyeshadow on. I'm going to use PART2, another eyeshadow palette. So one thing about Boxycharm is that they send eyeshadow palette every single box. So that means that I have gotten 6 boxes in the last 6 months, which is like a lot, you know. In reality, a woman can just get by with a couple beauty boxes a year. I have ordered Boxycharm since last year's September, so it's like, I think it means I have total gotten 8 eye palettes already. So that's a lot of eye palettes. So I feel like if anything to change about Boxycharm is just, you know, not maybe send the eye palettes every single time, maybe every 3rd box is enough, because that's like a lot of eye palettes. You just don't need that many. On the other hand, I love getting them. It's just maybe not necessary. So next I'm going to put on mascara. In the last 6 months, Boxycharm has sent me 2 different mascaras from Lorac Pro Lash Pomade, and the other one, Too Faced Better Than Sex Mascara. I'm going to use this one. I'm going to actually use these guys first. These are from Shiseido. That you guys have suggested several times is to make videos about my trips to doctors. Unfortunately, the hospital has a policy that you're not supposed to videotape anybody on anything there unless you get a permission. So I would really like to make a video about my doctor's visits, but I feel like it's going to be difficult. So I'm going to use this blush. So if I somehow going to figure out how to make a video of my trips to the doctor, I think I'm going to do it, but until then I don't think I can do much about it. So what we're going to discuss today in my doctor's office is of course how I have been, and I think I can easily say that I have been quite well. This is just highlighter I'm going to add. I'm almost done with my makeup. So some time ago I had MRI done right? If you look my previous videos, I'm sure I talked about it. And the reason we did MRI was to just figure out if somehow the pain in my back can be diminished by radiation, basically doing radiation, killing the cancer. And so MRI was supposed to very accurately show where the cancer exactly is and if it can be done. So I really hope to get good news that they can somehow lower the pain level, because then I would be able to take lower amount of painkillers, and always less medication I take, the fewer side effects I have. So, right, the higher quality of life, basically. In the past 6 months, Boxycharm has sent 2 different lipsticks. Today I'm going to try to use one from Becca. But this guy, right, has 2 parts. It has this lipstick part, and it actually nicely has a magnet, see? And on the other side it has a primer for lips, which I'm going to try. So one of the biggest issues with makeup is, at least for me, is that lipstick is never staying on. It's just like constantly needs reapplying if you want to have lipstick on. So I wonder if this primer actually is going to help. We'll see. Yeah, so these are the 2 highlighters that Boxycharm has sent. This one is just like translucent holographic lip gloss. It's like golden. If I do a swatchy. And that's it. We're done. Thank you for coming to see my channel. Bye bye.